Hello and welcome to week 1 of Public Health 612, Designing and Evaluating Public Health Interventions. Today we are going to review the context for health program development and evaluation. The learning objectives for this week are to be able to define evaluation, understand the public health pyramid and its relevance to health program planning and evaluation, and describe scenarios when an evaluation is not necessary. This lecture will highlight some key definitions, frameworks, and models which will be useful as we proceed this semester. As we begin, it's important for us to share a common understanding of what health is. According to the World Health Organization, health is defined not only as the absence of illness, but the presence of well-being. This is the most widely accepted definition of health. Furthermore, health is viewed holistically and includes physical, mental, social, developmental, and financial capabilities. Recently, WHO has highlighted the financial aspect of health and the fact that about 100 million people globally are being pushed into extreme poverty. In other words, living on less than $1.90 a day because they have to pay for health care. Universal health coverage means that all individuals and communities receive the health services they need without suffering financial hardship. WHO is pushing governments to pledge to ensure their citizens will have access to health coverage. This brings me to the last point, that health can be viewed as political, and as with the case of universal health coverage, the decision of policymakers about how to fund and ensure access to care are political decisions, and therefore who is in office, the economy, and other factors will impact health program planning. Here are some of the target areas for the Healthy People 2020 objectives. The Healthy People goals and objectives were first published in 1979 and since have become the framework for the development of state and local health promotion and disease prevention agendas. Setting goals and targets for each of these areas increases national coordination of health promotion efforts, and it gives the nation a goal to aspire to. However, at the end of each 10-year cycle, many of the objectives are often not met, and leads to discussions around the need for future health planners to be more realistic in setting their goals. Since 2010, the Healthy People goals have been created with input not only from academics and researchers, as well as clinicians, but also from community members contacted online or in public forums. The consistent involvement of diverse stakeholders in setting the nation's health goals will be something that we will discuss at each stage of the planning and evaluation cycle. Understanding the difference between programs, projects, and services is important for understanding the evaluation and planning needs of each. Public health programs tend to focus on prevention, provide educational services, and deliver services at the aggregate or population level, while health services tend to be typically direct services and are provided to the individual. As you can see here, planning and evaluation are cyclical processes with interdependent activities. The cycle often begins with a trigger event, which is not shown here, such as the awareness of a new health problem, such as Ebola, or a media expose of a health issue which hasn't been properly addressed, maybe food safety. The trigger event will determine if this issue gets the attention of key stakeholders. The trigger event will then lead to the collection of data about the health problem, such as a community needs assessment. And from there, health problems are identified and program and evaluation planning begins. During the program implementation process, this is when process evaluation is conducted to evaluate to what extent the program is being provided as they had planned. This information from the process evaluation provides key feedback into the revision and improvement of the program delivery. The health program should improve the health of the individual program participants, the community, or a population at large, and is assessed by an outcome or an impact evaluation. We will discuss both of these in greater depth throughout the semester, but keep this framework in mind as we consider the steps and processes involved in an evaluation and the cyclical nature and the feedback loops inherent in the process. As evaluation has become professionalized and standardized, the 5 standards seen here have been established by the Joint Commission on Standards for Educational Evaluation. In summary, the evaluation must be useful to those who requested it. It should be feasible, in that the ideal evaluation may be too costly or time-consuming and therefore not practical. So we need to make sure that our evaluations are feasible and can get done. They also need to be ethical and politically correct, and they need to be accurate and use scientifically rigorous methods. And overall, the evaluation should have adequate documentation to hold the evaluators and program accountable and encourage further research, which may compare the program in a meta-evaluation. So when do we conduct an evaluation? Here are some common triggers that lead to an evaluation being conducted. Those of you who work at a community-based organization or on a grant-funded program are probably familiar with the need to conduct an evaluation of grant-funded activities to demonstrate to the funder that the intervention they funded is being implemented as described and is achieving the intended results. Other triggers could be local activism, such as a community group wanting to find out more about what's going on in their community. The next 2 slides outline the stages of a program life cycle and their corresponding assessment, implementation, and evaluation. And there is a good example of how the hospice program in London began as a grassroots pilot and over time as they began to control what was being done and who was being admitted, building a model that could then be replicated. Ultimately, hospice programs became standardized, institutionalized services in organizations. And here you see different ways for evaluating it based on which stage it's at. There are many types of evaluation, each with a specific focus, purpose, and skills required. Community needs assessments, as mentioned before, are often done at the early stages of the program planning and evaluation cycle to collect data about the health problems of a particular group. Process evaluations focus on assessing the quality of the program intervention and the degree to which the program was implemented as planned. Effect evaluations answer the question, did the program make a difference? Outcome evaluations focus on immediate effects of the program, while impact evaluations have a more long-term focus. I also want to flag that sometimes these terms, outcome or impact evaluations, are used interchangeably, and we as public health workers and evaluators, we need to be more consistent and make sure that we're using the correct terminology and everyone is on the same page. Cost evaluations examine program efficiency and the costs associated with a program. Cost evaluations can include cost-benefit and cost-utility analysis, and they're typically done at the end of a program to weigh the investments against benefits of a program. These are a specialized type of evaluation and often require some economic background. And we will continue to discuss them throughout the semester to make sure that you can digest and interpret cost evaluations appropriately. Comprehensive evaluations, as the name implies, include all of the previously described evaluations, and given the resources required to do all of these different types of evaluation, are relatively uncommon. And then finally, meta-evaluation, as I previously mentioned, combines the findings from previous outcome evaluations of various programs for the same health problem. This type of evaluation relies on the availability of existing information about evaluations and the use of specific methods and statistical procedures. So therefore, we want to be comparing apples to apples to make sure that we're getting an accurate portrayal of how the program did. While rare, when done, meta-evaluations are powerful evidence that an intervention had the desired effect, and they can be incredibly useful in influencing policy and funding decisions. And this type of evaluation is typically done by academics and researchers, not program staff, because of the technical expertise required. Here you see the public health pyramid. Health programs exist across all levels of the pyramid. At the top are direct services such as medical care. These direct services often have an immediate effect on individuals, and they require considerable effort with minimal population effects. In other words, the smallest proportion of the population receives them. In public health, we often talk about working upstream on health issues to prevent disease from developing and the need for direct health services to treat illness. These efforts require enabling services, which are health and social support services that enhance the health of groups of individuals, such as case management programs for people living with HIV or nutrition education programs in schools. Population-based services are even more broad and serve an entire population, such as a city, state, or country. An example would be raising the Medicaid eligibility thresholds in the Affordable Care Act. Lastly, at the bottom of the pyramid are infrastructure services such as laws, skilled and knowledgeable health professionals to identify, track, and treat diseases, and information systems such as electronic health records, all of which support the healthcare system. As each level of the pyramid requires different professionals, expertise, and aims to serve different populations, they will have unique challenges for evaluation. The public health pyramid was created with the understanding that the individual behavior and health are impacted by social and physiological environment in which individuals live. This is called the ecological model. In this model, individuals are seen as parts of larger families, neighborhoods, populations, and political, social, and health environments, and that all of these factors impact each other and ultimately health outcomes. As we consider interventions and programs during the semester, it will be important to keep in mind the public health pyramid and the ecological model in considering how these different levels are impacting a health outcome, at which level the intervention that we're evaluating is trying to intervene, and how best to evaluate these interventions. Sometimes it's not appropriate to evaluate a program. While the first scenario, such as there are no questions about the program, is unlikely, or that the program may have no clear direction, the final scenario where there isn't enough funding to conduct a sound evaluation may more often be the case and require some discerning from you as an evaluator about if it's appropriate to move forward with the evaluation. Lastly, here are some additional resources for more information about evaluation. And as we move through the semester, you can look back here at the Centers for Disease Control or some of these other sources for good information. All right, that's it for week 1. Thank you so much. And please, as always, feel free to email me if you have any questions or concerns.